Good evening, doctors. Today we are going to do preventive and social medicine. This is a very important subject because at least 25 to 30 questions, and that is a weightage of 120 to 130 marks, will be from the preventive and social medicine. And most of the questions are direct questions. So if you practice these questions properly, it will be very easy for you to sail through the PSM portion of the NEET PG entrance exam or INACT exam. So let us move forward with the first multiple choice question in preventive and social medicine. Number one, in a normal curve, what is the percentage of distribution of one standard deviation? This you will be able to easily answer. The correct answer is 68, but let us look at the options. A 68%, B 34%, C 99%, D 95%. So the correct answer here is A 68. Approximately 68% of distribution falls within plus 1 of the standard deviation, plus 1 or minus 1 of standard deviation of mean. Approximately 95% of distribution falls within plus minus 2 standard deviation of the mean. Approximately 99.7% of distribution falls within plus minus 3 standard deviation of the mean. Please click the link in the description box to join the ultimate NEET PG event, which is going to be held this Saturday and Sunday. In normal curve, what is the percentage of distribution of one standard deviation? It is 68%. Now let us move on to the next question. Cross product ratio can be derived from A. Ecological study, B. Cohort study, C. Cross-sectional study, and D. Case control study. Cross product ratio means odds ratio. This odds ratio can be derived from case control study. So correct option here is D, case control study. Cross product ratio, odds ratio can be obtained from case control study. Odds ratio, it is a measure of strength of association between exposure and outcome obtained in a case control study. If the odds ratio is less than 1, there is a negative association. If the odds ratio is equivalent to 1, there is no association. If the odds ratio is more than 1, there is a positive association. So odds ratio less than 1, negative association. Odds ratio equal to 1, no association. Odds ratio more than 1, positive association. You can WhatsApp me directly on this number 9483652020 regarding any doubts regarding NEET PG or INACT, any difficult MCQ, any difficult topic. Please tell on which topics should I bring the lectures. Please comment in the chat box. If you comment, then I will read every comment and I will reply to every comment. So please comment in the chat box. Thank you. Now the next question. The risk of genetic disease in consanguineous marriage between first cousins is consanguineous marriage, first cousins, risk how much? A 1 to 2%, B 4 to 8%, C 8 to 10%, D 12 to 14%. So the correct answer here is B 4 to 8%. The risk of genetic disease in consanguineous marriage is between first cousins is 4 to 8%. So the correct option here is 4 to 8%. The risk of genetic disease in non-consanguineous marriage is 2 to 4%. If it is non-consanguineous marriage, it is 2 to 4%. If it is consanguineous marriage, it is 4 to 8%. So remember, consanguineous means more 4 to 8%, and non-consanguineous it is 2 to 4%. As we all know, the risk increases with consanguineous marriage. So consanguineous marriage, the risk is 4 to 8%, and non-consanguineous marriage, it is 2 to 4%. Please click the link in the description box to join the ultimate NEET PG Breakthrough Masterclass event. 2-day event. It is a 2-day event. Next question. Which of the following parameters would you use to check the efficiency of surveillance system for malaria under the National Vector-Borne Disease Control Program? A. Slide positivity rate. B. Annual parasite index. C. Annual blood examination rate. D. Slide falciparum rate. It is annual blood examination rate. This ABR or annual blood examination rate is used to check the efficiency of surveillance system for malaria, as it takes into account the number of slides examined for the population under surveillance. This World Malaria Day is celebrated on April 25th. Again, this can be asked as MCQ every year, April 25th. The theme for this year's campaign is Zero Malaria Starts With Me. The campaign aims to keep malaria high on the political agenda, mobilize additional resources, and empower communities to take ownership of malaria prevention and care. So the correct answer here is annual blood examination rate. Please like, share, and subscribe. According to Integrate Management of Childhood Illness (IMNCI), a 6-month-old child is said to have pneumonia. The child has a fast breathing with a respiratory rate of more than A60, B50, C40, and D30. It is 50. A 6-month-old child presenting with respiratory rate of more than 50 is is classified as pneumonia. Three clinical signs are used to assess a sick child with cough or difficulty in breathing. Respiratory rate more than 50 for infants 2 months to 12 months, more than 40 for children 12 months to 5 years. The test of choice to measure the difference in mean between two groups in a study with one group being a control is A chi-square test, B Z test, C unpaired test, D test, D parity test. Where it is unpaired t-test. Paired t-test comparing means in paired data. Unpaired t-test comparing means in two different group of individual. Z-test, it is a variant of t-test which used when the sample is more than 30. Chi-square test comparing percentage, proportion and fractures. ANOVA comparison of several groups. The test of significance done for two or more proportions is A chi-square test, B student t-test, Z CZ test, D ANOVA test. It is chi-square test. Chi-square test is a measure for the test of significance for non-parametric data set. Chi-square value at probability 0.95 or 95% confidence level at degree of freedom 1 is 3.84. So it is a chi-square test. Triage is done during disaster management to ensure treatment of casualties is done properly. What is true about triage done at disaster? First come, first treated basis. B. Moribund patient receive the lowest priority. Green labels are those who need to be transported on priority. Most commonly used system is three-color system. So, what is true here? Moribund patient receive the lowest priority. Moribund patient receive the lowest priority. This is because despite paying utmost attention, the benefit is still questionable in moribund patients. Which of the following part of concurrent list of Indian Constitution? A. The probability that a patient tested positive actually having the disease is questioned is called as A. Sensitivity, B. Specificity, positive predictive value, negative predictive value. The correct answer here is positive predictive value. Positive predictive value implies the probability of a person with a positive test actually having the disease. Sensitivity, ability of screening test to identify correctly all those who have the disease. Specificity, ability of screening test to identify correctly all those who don't have the disease. Positive predictive value, ability of a screening test to identify correctly all those who have the disease out of all those who test positive. Negative predictive value, ability of a screen test to identify correctly all those who do not have the disease out of all those who tested negative on screening test. If multiple tests are applied in series, the specificity of the complete testing increases. If multiple tests are applied in parallel, the sensitivity of complete testing increases. So let us